Hi everybody, it's Adam, the geneticist from Verdure Healthcare. Welcome and thank you so much for joining me in this Facebook premiere on the second chromosome. So today we're going to talk about the second largest chromosome in the human body. So as you might recall, in a human we need 23 pairs of chromosome. So last week we've talked about the largest chromosome in our body, and today we're going to talk about the second largest. So on the second chromosome there are over 243 million DNA. That's a lot of DNA being packed into something that we can't even see. So just to recall, if you forget about the relationship between a chromosome and the DNA, so in our human body there are lots of cells, okay? They perform different functions. Some are on our skin, some are in our blood system, and some are even in our bones. So within the cells, there is a command center called the nucleus. And within the nucleus, there are the cell commanders. They are called the chromosomes. So for chromosomes, you can imagine as though it is a ball of strings. Okay? So when you pull out the strings, it is equivalent to the DNA being pulled out from the chromosome. So in summary, it is actually the genes being packed together to form the chromosome. And in humans, there are only 4 kinds of DNA, G, C, A, and T. So this is just a brief reminder. If you haven't watched my introductory video, I would strongly suggest you to go and watch it first before proceeding, because it contains a lot of information that are critical to understand what I'm going to tell you next. So the video links are included in the caption. If you have time, please go and watch them. And so proceeding on, in the second chromosome, there are over 243 million genes that makes up 2,500 genes. Okay? So as you can see over here, there are different locations on the chromosome itself. And there are a lot of diseases it can cause. So currently, science found that there are over 30 diseases that are associated with chromosome 2. But these are just more common ones that I'm going to list out to you and I'm going to share with you briefly. So I think one of the most common one would be colon cancer. So why? What happened in a colon cancer? Okay, so in this region, it contains 2 genes, MSH2 and MSH6. So these 2 genes are responsible for controlling colon cancer. So if you had a mutation in either one of these, your risk of getting colon cancer during your lifetime will be significantly higher compared to the general public. And of course, there are others called the 2q37 deletion syndrome, essential tremor, and MBD5 associated neurodevelopmental disorders, Ring syndrome 2, SATB2 associated syndrome, and Trisomy II. So these 7 diseases, I'm going to introduce them to you. So just a reminder, for the types of disorders related to so-called genes, there are 2 types: single gene disorders and chromosomal abnormalities. Chromosomal abnormalities, just like, for example, Down syndrome, so there is an extra copy of chromosome 21 that causes Down syndrome. So it involves the largest pieces. So single gene disorders whereby just one of this GCAT DNA has a bit of a problem. Okay, whether it is a duplication, meaning an extra copy where it shouldn't be, or a deletion where there are bits and pieces missing. Yeah, so these are the more common types, or a substitution whereby if this is, for example, red color and it's being replaced by a blue color gene, for example, that's not right as well. So for this one, 2q37 deletion syndrome, it doesn't even have a name. Science doesn't even have a proper name for it. So 2q37 is actually a region in chromosome 2. So just like, for example, colon cancer just now, the MSH2 and MSH6, it contains a region. So 2q37, it is also a region in chromosome 2, whereby if anybody or the kids that have this gene missing, they will have some intellectual disabilities, behavioral problems, and sometimes even skeletal, meaning abnormalities involved with the bones. So as you can see, example here, they have very short fingers and potentially very short toes as well. So in terms of colon cancer, I'm sure majority of you have heard of it before. So it is a cancer involving the last piece of our digestive tract, so the colon. So the colons are separated into parts 1, 2, 3, 4, 5, and 6. 6 parts in total. And this colon cancer can happen anywhere within the colon. Okay? And so, essentials tremor. Now this is something that not many people has heard of. So it is a neurological disorder whereby that person will have involuntary tremors, the shaking of the hands. So it is a little bit like Parkinson's disease, except this is more on the hands. So as you can see here, a normal person can draw a circle like this very beautifully, but people with essentials tremor, they just can't because they are shaking. Right. So NBD5 associated neurodevelopmental disorders. So it is actually involving our neurosystems, whereby from birth itself, there will be some intellectual disabilities, there will be some learning difficulties, a lot of speech problems, sleeping problems, and even behavioral problems as well, right? And then ring syndrome. Now this is something very special. It involves whereby, okay, as you can see, this is the chromosome itself. If, imagine this, the top and the bottom end has been missing, okay, or has been deleted. So these two parts will stick together, just like this, in a ring. So in this case, we'll be able to see the chromosomes being abnormal immediately, almost. So for anybody who's having ring syndrome, ring chromosome 2, they will have usually small heads, some heart problems or defects even, and you will be able to see it straight away that this person is very special because they have very distinctive facial features. Right. So for SABT-associated syndrome, so it is also involving intellectual disabilities, whereby they will have very special shape of the teeth, of the mouth, yes, and then a lot of speech problems, and there are a lot of organ system problems as well, sometimes involving the reproductive system, sometimes even having problems with the urology systems and things like that. So it is a very serious problem as well. And then trisomy 2. Trisomy 2, again, it is involving the overall chromosomes. So as you can see here, this is the lined-up graph of our chromosomes. And on the second pair, supposing it used to be like this, and now there is an extra piece over here. So, but this one, it wouldn't involve intellectual disability, or most cases it wouldn't. But what it will do is anemia, because anybody with trisomy 2, most likely they will have low counts of red blood cells, and they have a form of blood cancer called acute myeloid leukemia. And this is one of the most difficult blood cancers to cure. Right, so that's it. These are the summary of the 7 diseases that are most commonly associated with chromosome 2. So if you're interested in digging deeper in any of the diseases, you can go back we can rewind and go back to the previous sections, and you will be able to search for each individual diseases. So now, over here, your question might be, what are the cures for such genetic diseases? Well, I have to honestly tell you, curing or cures for genetic diseases are more like scientific fantasies instead of something practical, because a lot of things are still, unknown to scientists and doctors. But anyway, what are the treatments that might be available depends on the particular situation. It could be gene transplantation, meaning to say that they cut out the piece of the defective genes and replace one with the normal gene. But once again, that's a fantasy. So yeah, if it involves the protein, for example, the final product that this gene produces, they might have some enzyme therapy for that. Metabolic dysfunctions, so for example, diet modifications, sometimes involving metabolic disease compensations. Organ malfunction, if it involves the entire organ, you might need a transplantation, or even surgical interventions to correct that mistake. And most importantly, prevention is one of the best measures, because if you have carried some of these diseases, then it is best to use alternative fertility solutions just like IVF or even ICSI to work around this particular problem. So how do we go about and test for these? Now at Verdure Healthcare, we have something called the PrePregnancy DNA Screening. Some people ask me, Adam, I don't have a family history of genetic diseases. I don't feel that I have genetic diseases. Why do I have to go for these tests? Well, okay, if you remember from my previous videos, I've drawn a research from the Chicago School of Medicine. So back in 2015, they have done research saying that humans carry at least 1 to 2 lethal mutations. So that means healthy individuals like you and me, we could be very well carrying some of these genetic diseases and we don't know, because it involves only one chromosome and we have the other good chromosome to back us up. Right, so let's have a look at the details. Humans carry 1 to 2, on average, mutations that, if inherited from both parents, can cause severe genetic disorders or death before reaching reproductive age. Right, so yeah, all the diseases that we've just described is in fact quite severe. So our Verdure Healthcare pre-pregnancy DNA screening, there are 2 parts to it. The first part would be to screen for your chromosomes. So we'll line up every single piece of the chromosome in you, and then we'll be able to see if there are extra pieces, if there are missing pieces that are visible at this level, and even ring syndrome. If you can recall just now, ring syndrome, what happened? It is due to the fact that there are pieces missing from the head to toe, head and toe, sorry, and that's why it becomes a ring. So at this level, we will be able to spot that. Trisomy II, an extra piece over here, we'll spot it immediately just on the first part alone. We can even see if there are anything swapped around. For example, like the case I've drawn previously, one of our clients had something swapped from the chromosome 2 to the chromosome 6, and then the other way around as well. So it can be a very severe consequence if you pass that on to your next generation. So that's why we asked him to seek IVF, and then I personally referred them to do it, and then they use something called the PreImplantation genetic diagnosis and screening to select healthy embryos so that the next generation wouldn't get such inheritance. Right, and yeah, we'll be able to see if there are any larger parts of substitution and translocations. And then, so most importantly, second part, we will be able to see the 155 most common diseases in Asia. Right, how do we do that? How is it even possible? Now, this involves single gene disorders. So single gene disorder meaning to say that we have to open up the entire chromosome. We will see the genes inside it. Now, the process of doing this is extremely complicated, so as you can see in this graph over here. So I'm not going to go over the details of how to line this up. If you are interested, you can go to YouTube and you can search on Google next generation sequencing. okay, NGS, and this is called. So just in summary, if you are interested, when these data are being produced, they have to be organized. And so this is called the genomic data science. Afterwards, when we get the hang of it, we'll be able to make the best fertility solution for you. Right, so this is one of our sample reports. So as you can see, this lady over here, the wife's side, she is carrying 3 diseases, okay? Beta thalassemia, Smith-Lemli-Opitz syndrome, and then Wilson disease. So these are all involving, for example, chromosome 11, okay, and then and this one is also chromosome 11, chromosome 13, and so this is the changes in the gene, okay? So as you can see over here, interpretation pathogenic, meaning to say that this is lethal. Likely pathogenic, it simply means that there is, a mutation, but there's just no scientific evidence to say that this will definitely lead to something severe. But don't worry, because this lady over here, she's only a carrier of these genetic diseases, meaning to say that because there is another good gene backing her up, so that means these mutations, although present in her body, it's not enough to cause her the disease. So the key here is that if her partner is also carrying, for example, beta thalassemia, there will be a problem, because the chances are 25% that this child will get beta thalassemia. There's 50% whereby they will be carrying the disease just like mom and dad, and then there's only 25% chance that this child will escape completely. So 25%, 1 in 4 chance is not a very good bet. Okay, so that's why when you do all these tests, it has to be reviewed by a professional. So currently in the market, it is quite lacking of these genetic counselors, what we call our geneticists. Why? Because you need a base of medical knowledge. So for example, myself, I am trained from the Royal College of Surgeons of England in surgery. Okay, so I'm certified as a surgical instructor. And on top of this, I still have to get training from Stanford University, especially in the Genetics and Genomics Certificate. And even afterwards, if you want to offer genetic tests to anybody, just like what I'm doing to you right now, you have to get even more specific qualification, such as genetic testing and sequencing technologies. Okay? And then, like I mentioned just now briefly, genomic data science. So after you've sequenced everything out, you still have to sort the data. Only after when you sort out the data, you can produce some meaningful decisions and really help people, whether it is related to fertility, related to cancer, related to other types of genetic diseases. Yes, okay, so I want to talk about this because in the market, and there are a lot of clients asking me about commercial genetic tests, or so in Chinese we call that 家用 DNA 测试. Okay, so what's the difference between clinical genetic tests versus commercial genetic tests? Okay, as you can see here, commercial genetic test, you can buy it online. Okay, you can buy it online, they will send you the kit via courier, and then within the kit, all you need to do is to collect your saliva, put that back into the tube, slot that back into the box, and send it back to them, okay, wherever they've sent the kit to you. So some of the most common companies providing these would be 23andMe. The other one would be Circle DNA. So if you watch YouTube, majority of chances are you will see one of their advertisements. So how do you juggle between these? Okay, a lot of people say that, are the commercial genetic tests accurate? Okay, you can't say that they are not accurate because after all, some of their genetic technologies are very high. They put in a lot of efforts as well. But there is still a difference between clinical genetic tests and these tests. So with these commercial genetic tests, the saliva versions, you can use it to know more about yourself. And so this is what we call precision health, okay? So everyone's genes might be different, okay? In fact, is different, not might, is different. So through these tests, okay, you can see what exercise are more suitable for you. For example, there are people who kept on doing exercise, but they still can't thin down. Why? Okay, is it because your DNA is not suitable for that kind of exercise? Could be. So you can use one of those commercial DNA tests to see which kind of nutrition, which kind of exercise or lifestyle that are more suitable for you. But for clinical genetic tests, because we will be having some clinical decision, it is better to use blood, okay? So with our pre-pregnancy DNA screening, I would ask you to come to our center, our fertility clinic, for a blood draw, okay? And then we will send the blood samples to the lab and run the complicated process you saw in the previous slide. Okay, so when the report comes back, I would have to personally counsel you and your partner as to what are the decisions that you should be making in order to ensure the health of your next generation. Right, so after we've made the decision, step 2, it is to enhance the quality of the egg cells and the sperm cells. Because no matter whether you are going for the IVF or going for natural pregnancy, there is still a very slight chance of getting something called spontaneous genetic mutation. Spontaneous meaning just happens by chance. Okay? For example, Down syndrome is actually due to the fact that genetic materials in the eggs or sometimes in the sperm cells are defected. Okay, that's why they have an extra piece in the slot 21. So in here, when we treat when we enhance the quality of our eggs and sperm cells, it will reduce this kind of risks. And at Verdure, we do have a lot of supplements to help you with this. And our supplements had won the Reader's Choice Award 2021 from Baby Talk and Mama Papa magazine. So I would love to use this chance to thank you so much for all of your supports and trusts. So some of our fertility supplements include the VHC formula Female 1 and Female 2. It pinpoints at the female reproductive system where we enhance the ovulation function, the menstrual cycles, as well as the egg quality. And for male, our VHC formula male enhances the sperm quantity as well as the quality in terms of their swimming capability, their shape, and etc. And then, we do have also after-birth recovery. It's called the Confinement 1 and 2, whereby after you've given birth, we would use this particular supplement to help you recover. And if in a rare case where you suffered a miscarriage, we can also provide you this supplement to help you recover and also to prepare you for your next pregnancy. Right, and also Verdure Healthcare, we have won the Superbrand Award, Malaysia's Choice in 2021 as well. And this is one of the most prestigious awards that any company can get. So very thankful, and we really appreciate your trust and also the opportunity that you are giving us. Right, and the third step is to literally get pregnant. So there are two ways of going about this. If, let's say, there are no mutations at all, you and your partner are clear of any genetic, carrying diseases, so we'll suggest you to use our home artificial insemination IUI to get pregnant. Because if you're thinking about going for IUI or IVF, okay, this particular kit is only 1 in 50th price of an IVF cycle. So that you only need to follow 3 very simple steps to grasp your menstrual cycle, to know and predict your ovulation, confirm your ovulation, use the component that we have, use the IUI component that we provide you, and get pregnant. So the first step is to grasp your menstrual cycle. All you need to do is just to plot your basal body temperature, the body temperature that you you are with when you awake first thing in the morning. So why do we need to measure this? Because during your ovulation, during the period of your ovulation, there will be a slight surge of the body temperature because there is something called the luteinizing hormones being secreted in your body. So as you can see, there is a surge in the temperature, and after you've plotted this kind of graph for about 1 to 2 months, you will be able to see a pattern. So when you see a pattern, okay, so these are the days that you might be ovulating, then the next step is to use the ovulation test kit. It's called the LH ovulation test, whereby all you need to do is just follow a few simple steps to test the urine, and you'll be able to see whether or not you are ovulating. So it will show you as positive or negative. And when it shows positive, then it is time to use the home artificial insemination IUI kit to actually transport the sperm cells directly into the uterus. So first of all, you just need to follow a few simple steps to assemble the components, okay? So the tube and the main component to transport the sperm. You collect the sperm cells on that day, okay? And you take up the sperms using the syringe provided, and then you insert the sperm cells directly into the uterus, and it provides you a shortcut. Right, so this is suitable for people particularly with low sperm count, poor motility, meaning to say the swimming capability, and also abnormal shape. Because if you have abnormal sperm shape, then it is very difficult for it to penetrate into the egg. So that is why we strongly suggest you, before you start anything, do take our VHC formula male to try and boost up your sperm qualities a little bit up first before you use this component. And for ladies with high amounts of antibodies or recurrent genital infections, and also pain during the intercourse that makes the entire process very uncomfortable, you can use this particular method to also inject the sperm directly into the uterus. Right, but on the other hand, if we spot any mutations, then we need to use second or alternative fertility measures. One of it is called the PreImplantation genetic screening or PreImplantation genetic diagnosis, whereby if you visit an IVF center, okay, so if you decide to take up the treatment, you would need to inject yourself with some IVF medications, and then the next step would be oocyte pickup, whereby the doctors would take your eggs and then they will fuse that with the sperm cells behind there in the lab. So when the sperm cell and the egg cells are fused together, after 5 to 6 days, then this thing will be an embryo, okay? An embryo whereby they will take a small piece, okay, of the cells inside in order to test for any chromosomal abnormalities, okay? So these are the general steps. So, and then people will ask me, and why, okay, if we were to secure our next generation's health, why can't we just go straight away, do IVF, do this PGS, PGD? Okay, first of all, money is definitely one of the problems, because you can go and search cost of PGS, PGD in Malaysia on Google or on Yahoo, you'll be able to see that it will come to a cost of around 35 to 50,000. Okay, so this amount of money should be spent very carefully and yeah, with absolute reason. So because another reason is that when the embryo is here, and when you take cells out of it, it can easily hurt the embryo. So the chances of success is actually a bit lower compared to normal IVF, okay? But of course, if another scenario, for example, if you don't have any mutations, but unfortunately, if you have blocked fallopian tubes, you still need IVF, then you don't have to go through PGS, PGD process. Right, so at Verdure, we do have a number of partners, for example, Genomics Lab, the DNA Lab, these are our DNA testing laboratories. For IVF centers, we work with Sunway, Thomson, Alpha Fertility, TMC Fertility Centers. So if we were to refer you to any one of these, then we'll be able to follow up on your case as well. So for example, if you have any particular mutations, I would personally talk to the doctor that we are referring you to, and then he will know your case. So for regular blood testing and sperm testing, we work with BP and Path Lab, and these are our long-term relationship partners, all of them. Okay. So one thing I want you to remember is that your genes will determine your baby's lifetime health. So as I mentioned before, genetic diseases, if you want to cure it, it's very difficult. Okay, there's still a lot of things that we don't know. So the best measure is to prevent it from happening. Okay, so if you're planning for a pregnancy, please do give us a call. We would love to hear from you. We will at least provide you with the best advice at your current situation and at your will. So depending on whether you come in and say that, oh, Adam, I want to do IVF. Okay, is PGS-PGD suitable for us? Adam, we are coming here just to, prepare for pregnancy in general. Can you please give us an advice on how to avoid genetic diseases? I would love to really provide you these advice. It's my joy and duty to do so. So, yes, after this presentation, I hope you can go back again and have a look at our previous chromosome 1 if you haven't done so, and also to review the introductory video, because that will benefit a lot for you. And then, so this video will be uploaded on YouTube. Okay, so do go to our channel, Verdure Healthcare YouTube channel, and search for genetic disorders. Okay, so all of the videos are along the series. Okay, and then I hope you can support us by subscribing to our channel, like our video, share this video to those whom you know are preparing for pregnancy as well. And I'll see you next week, where I will talk to you and share with you facts and diseases that chromosome 3 can cause. Thank you very much and have a wonderful day ahead.